Scanning the room. Scanning the room. This is where the camera will be. Put this, oops, down like that. So then I would, may I come in?
Yes, we can.
All right, so then I would close the door behind me. I would do hand hygiene. Hi, I'm Alexis. I'm going to be a student nurse today. We're going to do an intramuscular injection via physician orders. Can you just state your name and date of birth for me?
My name's Almicus, 29, 2009.
And do you have any allergies?
No.
Okay, so then I would verify name, date of birth, allergies, and physician's orders with the patient's chart. So on a scale of 0 to 10, 10 being the worst, can you tell me your pain level?
6.
All right, so then I would verify that there was a standing order for the pain medication to be administered, and then I would check to see the last time the pain medication was administered. So there's 3 sites to give intramuscular injections. The first one is the deltoid process, the vastus lateralis, and then ventral gluteal. So for the deltoid, I would find the acromion process, and the base of that, I would go 3 fingers down, and so I would say I would inject right about there. And then if you could step up so we can better see. Hold your shirt, kind of go a little bit to the side. All right, so then I would find the greater trochanter and the lateral femoral condyle. And so then I would have this hand here, and I would inject right here in that imaginary triangle. And then for the ventral gluteal, I would again find the greater trochanter, and typically I would have my palm on it, but because he is smaller, I'm gonna drop it down like that. And then I would have the iliac crest and iliac spine, so then I would do the injection here. All right, if you want to sit back down. Okay, so then for the medication, I'm going to say this is Mepridine. I would make sure that's what it is. I would make sure that the expiration date, it's not expired, and then the integrity of the medication and vial are good. And then, so we'll say I'm gonna do Mepridine. The treatment is moderate to severe pain. It binds to opioid receptors in the central nervous system and alters the perception of and response to painful stimuli while producing generalized central nervous depression. Common side effects are confusion, sedation, nausea, vomiting, constipation, and hypotension. Serious side effects would be anaphylaxis and seizures. Potential lab tests would be plasma, amylase, and lipase concentration, because this drug can raise those levels. The antidote would be naloxone or Narcan, and the IM onset would be 10 to 15 minutes. So then, for my needle, I would use a 20, what I have here is a 22 gauge, 1/2 inch needle. And for that, this way the medication can come through that gauge of a needle. And the reason for the length is so that it can deliver the medication into the muscle. You can have 21 to 25 gauge, 1 inch to 1/2 inch, and if you have an obese patient, you can go up to a 3 inch in length needle. So then I would open this up, and I would unscrew the injection needle, keep it in the package. I would get the blunt filter needle if needed. I would set that down since it's still intact. I would use, this is going to be my alcohol wipe. So I would cleanse the top of the vial for 10 seconds. And once I have that, I'm gonna say we're gonna do 2 mLs of the drug. So then I would pull back 2 mLs of air, and then I would twist off, oops, not the entire thing, but I'm gonna pull off the safety, and then I would inject that air into the vial. Then I would pull back more than 2 mLs of the medication so that I could push out any extra air or anything. And then while keeping the needle and everything in place, I would check the dose with the MAR, and then I would ask a second nurse to come in and verify the dose and medication. And while she is doing that also, I would be checking with her against the MAR. And then for my second check, after all that, I would check the medication and dose against the MAR again. And then I would make sure I have the right patient, the right drug, the right dose, the right route, and the right time. And then once I do all those, I would do my third check, and I would check the medication dose against the MAR. Once everything would be good and in place for that, then I would go and take this out. And during this, I would have washed my hands prior and put on gloves, so I would normally be doing this with gloves. And then I would take this off and put it into a sharps, but because I'm going to keep it, I'm going to safely recap it, take it off, set it to the side. Then I would reattach the injecting needle, and because everything is still intact and it's not open or anything, I'm going to set that there. Then I would, normally the patient would be in a laying down, but you can also do sitting. I would make sure it's exposed. I would find my landmarks, and then I would appropriately see my spot, find my spot. I would take the alcohol wipe, and I would start in the middle, just circular motions, and then not touching where I've sterilized. I would lay that there so I know that's where I want to inject. So then I would let the patient know that once I'm done injecting, the medication will set in between 10 to 15 minutes, and then I would pull this back, not touching the site of injection. I would pull the skin nice and tight. I would tell the patient that there's going to be a prick, so then I would push the needle in. Typically the needle would be down, so it would be a little bit easier, but I would stabilize with my non-dominant hand. Then I would pull back, I would aspirate, and I would wait about 5 to 10 seconds to make sure that there was no blood that came with that. And then once that was done, I would start pushing the medication slowly over 5 to 10 seconds. And then once the medication was fully injected, I would still hold the needle there for 10 seconds. And then once that was done, I would pull this out, put my safety, drop it into the sharps container. I would have a 2x2 for any extra blood or anything like that. Then I would get a Band-Aid if needed, and then I would put a Band-Aid on that. But then I would wait, and I would see if there was any adverse reactions at the site. And then I would also reassess the patient in 10 to 30 minutes after that. And then I would be done with that. And I would ask the patient if there was anything else I could do for you while I have time.